Hi, I want to talk about heart attacks, some of the signs and symptoms of heart attacks. And before we begin with that, I want to do a quick review of what is a heart attack and what causes it. I have a model of a heart here, and if you notice this, we have arteries, coronary arteries throughout the heart because the heart is a muscle and it requires blood and oxygen to it. During a heart attack, what happens is there is a blockage in one of these arteries, and past that blockage, what could happen is that the muscle groups that are here may not receive enough oxygen and blood, and then this can lead to a heart attack, which can lead to, weakened heart muscles, and in extreme cases, can lead to a heart damage and maybe even cardiac arrest. Heart disease is still one of the biggest killers of both men and women in Canada. Men are twice as likely to suffer from a heart attack as compared to women. But when women get a heart attack, it is more fatal than in men. Now, there are differences in the body between men and women that tend to get heart attacks tend to be a bit older, but also maybe one of the reasons why women die from a heart attack more than men is that they don't necessarily recognize some of the signs and symptoms of a heart attack. Let's talk about that. In the past, there's been a lot of emphasis on education and really explaining what heart attacks are in men, and we kind of forgot about women. In fact, the radiating intense chest pain that men tend to experience can be experienced in women, but about half of women that have experienced heart attacks said that is not one of the symptoms that they experience. So let's talk about some of the other signs and symptoms of heart attacks in women. So it's important for women to know that there are other common signs and symptoms when it comes to heart attacks. So discomfort in the neck, jaw, the shoulder, upper back, and even upper belly, the abdomen. There may be shortness of breath, pain in one or two arms, sweating. There could be lightheadedness or dizziness, just some sense of nausea, maybe some vomiting, unusual fatigue, and heartburn. As you can see, some of the signs and symptoms can be easily dismissed for something else. So it's no wonder why some women may not think that they're having a heart attack. So if you or someone you know are showing some of the signs or symptoms of a heart attack, you know what? Sit down, have that person sit down and call for help. You might think it's not something that is major, but it better be safe than sorry. It might be something as benign as indigestion or something else, but so what? Go to the doctor, go to the hospital, get checked out, because not getting checked out can lead to severe health consequences. So if you are experiencing some of the symptoms of a heart attack, don't take a chance, call for help. Do it for your family, do it for your friends, but more importantly, do it for you.